See.
How to calm a child who is having a nightmare. Persistent nightmares could mean that your child is feeling stressed or worried about something, like starting preschool or being potty trained. Help your child to deal with whatever is bothering him, and you'll both sleep tight. You will need a reassuring demeanor, anti-monster spray, a comforting toy or object, a nightlight or flashlight, and a calming bedtime ritual. Step 1. Go to your child as soon as you hear him calling that he's had a bad dream. Hold him close. Tell him over and over if necessary and in a reassuring tone of voice, "Mommy's here," or "Mommy and Daddy are here." Step 2. Don't push him to tell you about the nightmare. He may get upset all over again. But if he wants to talk about it, listen sympathetically. Bad dreams are especially scary for kids under 5 who can't tell the difference between what's real and what's not. Step 3. If he's worried about something in his room, a monster in the closet, a dragon under his bed, get rid of the beast by sweeping under the bed and then spritzing the room with a water bottle marked anti-monster spray. Step 4. Give him something to cuddle with. Step 5. Turn on a nightlight or give your child a flashlight to keep by his side. Once your child is calm, stay with him until he goes back to sleep or is close to drifting off. Don't offer to sleep alongside him, and don't invite him into your bed. You'll just start a bad habit that will become a nightmare for you. Step 6. To keep the nightmares at bay in the future, don't expose your child to scary images before bedtime. Establish a calming and regular bedtime routine. Did you know nightmares usually occur during REM sleep, which is when you're most likely to dream?
Which is what you mentioned in the first segment as well, that's the time. But that kind of sleep is important for children, I'm sure. But this is, if your child is experiencing a nightmare, what you should do just to calm him down. And this is important too, isn't it? That you reassure them and make them feel that, you know, they're not fighting monsters alone.
It's as it very clearly mentioned, this is time the child's imagination is at a very high peak, right? And the child is unable to see the difference with reality and what is not real. So reassurance from the parents are really important, but as I mentioned before, it's a very soothing routine we should have before you put the child to sleep, like a nice shower, you have pajamas and you read a book. It's all about making him comfortable as possible, and try to keep away all kind of bad thoughts from his mind. And of course, to tell him sleep is a very good thing, you know, show him the bed is so comfortable, and little things that will keep him so happy going to his bed.
That's very true. I mean, as an adult, there's no problem. You don't need to convince anyone that you have to go to sleep.
You wait to go to your bed.
You wait to go to sleep, but I guess it's different when you look at it from the point of view of a child. But speaking about soothing rituals and things that you can do before bed, I'm guessing that things like watching TV right before you go to sleep is a big no-no.
It depends, but you should not forcefully take the child off halfway saying it's bedtime. Then it upsets them. So if they're watching a program, then you might need to check on the time. Either you give them permission to watch it or better avoid it before they go to sleep. Because when you put them to bed with bad thoughts or upset, they really have issue in settling down for a while. They get a bit cranky, so then it's another situation to handle.
Definitely. So there are so many things that children have to deal with when it comes to these different transitions. But if your child is really rebelling against maybe going to bed at a specific time, or most often they don't like to sleep alone, and if they really cause a scene about it, then is it better to just let that moment let that go for the moment and try again another time, or should you sort of enforce that, and is that important?
No, you cannot enforce sleeping patterns onto a child. It's a routine, but it is very rare if a child is that adamant to not go to sleep unless the child is actually suffering from severe anxiety or stress.
Okay.
Right? And that is a complete different sleeping disorder. But most kids young as from 1 to 3 years will not suffer that kind of disorder unless they're exposed to some kind of environment or some brain damage kind of thing where they will have to look into. But other than that, children will always stick to a routine, and they're actually very comfortable following a routine at this age. So it's how you enforce it on them.
Definitely. So as parents, it's very important to realize how you can really communicate with your child and get them to understand how important it is, how important sleep is. Now adults have no problem understanding this, but children are a different matter altogether, I think. So we'll be right back after the break on Good Morning Sri Lanka. Do stay with us. Welcome back to the show. Now speaking about sleep patterns in very small children, and of course we have our child care expert Arundhati on the show with us, and she's been giving some helpful advice as well as some insight into how you can really help your child transition into regular sleeping patterns as they grow in age and their need for sleep becomes different at each stage. But there are some stages where some children undergo this problem of bedwetting, and it's something that's very common, but apparently 90% of children feel that they are the only ones who go through it, and it becomes a source of embarrassment maybe for them, and they don't really like to speak about it, but it's something that's so common and lots of children experience. So what's the cause of this? What's the root cause of bedwetting and this type of behavior?
Well, generally they say kids, 100, basically if you have 100 kids, 15 out of them will have this problem, right, bedwetting. It has no it has no relevance with psychological or physical problems.
I was just going to ask you that.
It is not. It is just that the bedwetting is, you would call these children deep sleepers, or as you said, kids who sleep like logs, right? So it's a thing which you need to train them, that you need to trigger it in them, that biologically when you have a nature call that you need to come up, because most of these kids dream that they are in the toilet, but they are unable to wake up from the sleep because they are like these real tight sleepers. So there is no worry about it. It's a very common thing. Kids just grow out of it. There is no remedy for bedwetting, but the only option you could look at is that sometimes maybe the kids have issues with bladder control. So if you think they urinate too much, or if their color of urine is not right, so this is time maybe you should check them with your doctor.
Okay, and that's important as well. But the main thing is, I guess, to reassure the child, and of course let them know that they're not alone in this, that it's not something to be ashamed of, and that it'll all get better in time. But we have some insights into how you can help your child to stop bedwetting, so let's go see what they are.
Stop wetting the bed. When your child can't control their bladder at night, it's frustrating for both of you. Here's how to fix the problem. You will need limited evening fluids and a moisture alarm. Optional, a medical evaluation, an over-the-counter stool softener, and medication. Step 1. Don't be concerned if your child has an occasional accident. Most children do until they're 5 or 6 years old. For 3 out of 4 kids, either a parent or close relative also wet the bed in childhood. See a doctor if the bedwetting started long after toilet training, or is accompanied by painful urination, unusual thirst, pink urine, or snoring. Step 2. Limit evening fluids, particularly caffeinated drinks, which cause increased urination. 8 ounces of liquid should be enough after 5 p.m., unless your child engages in sports or other activities that would require more hydration. Speak to your doctor about what's appropriate for your child. Step 3. Try a moisture alarm, a small device that connects to a moisture-sensitive pad on your child's pajamas or bedding. When the pad senses moisture, the alarm goes off, conditioning your child to wake up when they need to urinate. Allow 3 months or more for the alarm to eliminate your child's bedwetting problem. For the alarm to be effective, parents have to take an active role by waking up with their child or waking their child up when the alarm goes off. Step 4. If your child doesn't have regular bowel movements, give them more high-fiber foods. Chronic constipation can contribute to bedwetting by reducing bladder capacity. If dietary changes don't work, ask your doctor about giving them an over-the-counter stool softener. Step 5. If the bedwetting isn't caused by a medical condition and at-home efforts have failed, ask your doctor if medication is in order. There are drugs that can help reduce bedwetting by either increasing bladder capacity or limiting urine production at night. They all have side effects, however, and should only be considered as a last resort. Did you know? Bedwetting is more common in boys than girls.
Oh, I see. So there is a gender difference in that as well, is there?
This is more common because the normal myth is they say the boys sleep very much tighter than the girls. So it's all about deep sleep. And the other thing is, I feel that it's a pattern you should get the children used to, and you should not let them feel ashamed that when they are wetting the bed, that it's like you should tell them it's a very normal thing. So again, as we boil down to the same thing, it's a routine because the brain doesn't trigger them to wake up to use the bathroom. So this is a very simple thing. You need to train your child without getting too excited about it.
Definitely. I mean, just as a child needs to be trained to talk and walk, this is just another process in the development of the child, and it's something that a parent should take in their stride and then address with the right type of action. But when we speak now, we've spoken about how important it is for the child to get used to specific sleeping patterns and sleeping alone, things like that. But let's talk about how important it is for the parents that their child is used to regular sleeping patterns.
Yes, because it's okay sometimes maybe you can't have the same routines maybe on holidays and stuff like that. But if you train the child from younger days to have a certain routine of waking up, eating times, sleeping times, brushing teeth time, children will just follow it without you really trying to make a fuss over it, right? But as you said, it's not only the child trying to be consistent, the parents also should try to be consistent much as possible to keep the route going. So it is two-way support. Yes.
And that's very important. So Arundhati, I think we've about covered all the bases when it comes to children and sleep. And thank you so much for being with us on the show this morning. And thank you so much for the insight that you've given to all the parents out there when it comes to how they can get their child to sleep normally and to sleep regularly for a regular pattern. So I'm going from the studio to another very special segment, and of course it's the out of the season, family and friends coming to visit you from all over the country, and of course you want to have something nice on the dinner table when it comes to greeting them. So food is very important part of any festival, and I met up with Chef Asanka Karunaratna, and he is going to show us how we can prepare a lovely dish this out of the season.